Hey,
Right behind that, Dr. Vanessa Augustine is right there.
Yes. Yes. Stand up, doctor.
I just want to let y'all know I don't know what your skirt on.
We will have a lot of health and wellness visitors there. Just FYI, Dr. Ann, her therapy business will be there. We will also have a myriad of other wellness opportunities there. Sound bowls, gravy, all the things from mental health all the way to food, fun, and fellowship. So whatever plans you had today at 2:30, you no longer have them. Come on now. All right. So, but seriously, one of the things that we do is this: is hormone health. How do we help you? What's the best way for you? Hormone health is very individualized. I can have this whole row as my patient, or Dr. B can see you all. Each and every one of you may be on a different plan. So it's the same hormones, but you may need more testosterone, you may need more estrogen, you may need more progesterone, right? And so you have to be candid and honest about what you're going through, right? So that we can help you more efficiently. So let's talk about that, right? Because a lot of times people hear hormones and they're just like, no, that's bad. Right. So in the late 90s, there was a study done by the Women's Health Institute, and it was this huge study with a random trial, which means that they took a lot of women, gave them placebos, gave some of them a specific form of estrogen and a specific form of progesterone, okay? Not progesterone, progesterone. So the outcome of that study was strokes, heart disease, and cancer. So then it became on the cover of Times. It was on every media outlet that they had in the 90s. This predates Instagram. But whatever the Instagrams were back then, that's what it was promoting. Stay away from hormones. It's not healthy for you. This is going to cause cancer. Red flags, red flags. A lot of providers today still operate from that space. But it's a lack of knowledge. Okay? So with the hormones, what you want to make sure you're asking about, are these bioidentical? Okay, because those are the safer ones. If not, how long can I use this for? Right? So, studies now are showing that when you use bioidentical, which means that your body recognizes it as its own. Once you use those types of hormones, it helps. And we're going to talk about why. Okay, so I mentioned 3 hormones. What's another hormone that you guys think of? Testosterone, okay. What's another one? Estrogen, another one?
Thyroid.
Thyroid, good one. Any others?
DHEA.
She knows. So there's a myriad, exactly. There's a myriad of hormones that all work together to create this cluster of a mess that we experience and we feel. So if you go into the clinic with just one chief complaint, I'm anxious. You have to paint the whole picture. Right? So that way we can say, well, it could be this hormone, it could be that hormone. But we're going to talk about the 3 big ones today: your estrogen, progesterone, and testosterone. When those are in balance and in sync, you feel great. When they're not in balance, you don't feel great. So that's the times where they're most predominantly out of balance: puberty, so your teenage girls with their attitudes, pregnancy, postpartum, that postpartum depression, that hair falling out, things of that nature, and then, like Jelsina said, perimenopause. When are you full-blown in postmenopause? You're done with all of it. After you haven't had it, how long? A year. A year. Very good. It has to be 12 months. If you, very good, 12 months in a row. So if you made it to 11 months and 15 days, and then she shows up, your year starts over.
Yep. Oh my.
How long does she have it? If you see her, she's there. What if she only stays for a day?
She popped in, right? Yeah.
So great question. If you have a hysterectomy and you still have your ovaries, a lot of times you're still going to get those perimenopausal symptoms. Hot flashes, night sweats, you still feel it. So from that regard, we go off of your symptoms opposed to bleeding. Okay? Great question. And then, for those who've had a total hysterectomy, no ovaries, no uterus, then from that point, a lot of times you're just on just from the onset. So, with that, let's talk about a few of the hormones. So let's start with estrogen, because that's one of the main ones that people think about, right? When estrogen is happy and in balance with testosterone and progesterone, your skin is great, your hair is great, your energy is good, you're stable mentally. Once that estrogen starts to plummet, you got attitude, you're gaining weight in your midsection. There's a direct correlation of your estrogen decreasing and your abdominal fat or fat tissue increasing. Now what are we calling abdominal fat? Sexy, cushion?
She said, oh my God. She said, fupa.
We're aging.
Oh, okay. Okay. Fan it back. Snuggle area.
As your estrogen decreases. Okay? So then we're like, well, what's going on? My hair is thinning. My skin is looking crepeier, drier, it's thinner. Could be your thyroid, but a lot of times it's your estrogen decreasing. Okay? And then we go to progesterone. Progesterone is one of the main ones that works well with estrogen to help with the hot flashes. And that way you only need your fan for the dance, that boots on the ground dance. Y'all know it helps with mood regulation. A lot of times during hormonal changes, you have anxiety or you're having depression. I had a 62-year-old patient a few nights ago, and she was like, I have ADHD. And I was like, 62? All these years, like, what now? And she was like, oh, that makes so much sense. You don't know what you don't know, right? So then the progesterone helps you sleep. You're not sweating as much when you sleep. There are people who have to change their clothes, like Carrie mentioned. You have to change your sheets in the middle of the night. The progesterone helps calm all that down. So now that you're sleeping, you wake up feeling a little more what?
Without the anxiety.
Exactly. Because decreased sleep, you can sleep for 10 hours, you don't feel rested. That's all a big part of perimenopause. Okay? So the progesterone helps with that. What was the other hormone that I mentioned? Testosterone. Very good. What do we think that testosterone does? What does it help with? Man. That's a man. So as men age, they don't call it menopause. Some of us call it menopause. But they go through bodily changes, and a lot of times they need testosterone. But women take testosterone too.
Yep. Sure do.
But that's what helps your energy. That's what helps your motivation. It gives you that get up and go. Because once you're going through menopause, you're tired. You have kids, grandkids, this man, woman, whatever your preference is, this job, all your extracurriculars, and you're tired. But you have to get these things done. Testosterone is what helps you do that. What else would testosterone help a woman for? Absolutely, your libido. And, yes, so your libido, your sex drive, and also maintaining muscle mass. When you're going through menopause, when your estrogen is decreasing and your testosterone is decreasing, your bones get broken. So now you're decreasing your risk of osteoporosis, you fall, you break your hip, or just walk sexy like I do, but not happen. But it's something that you can prevent and or help. It's never too late to start testosterone or hormone therapy in general. I have patients that are in their 70s that are just now starting. I have patients in their 70s that just refuse to get off because they're feeling so much better. And when they take a break and they get off, they're like, oh no, I can't. Yes, ma'am.
When should you start having like a hormones check as far as to see where they're?
So that's a great question, right? And the reason why that's a great question is because if you're in that perimenopausal window before you hit menopause, 9 times out of 10 your labs are going to be completely normal. And then patients are devastated because they're like, why do I feel this badly or this poorly and my labs are completely normal? It's because a lot of times perimenopause is symptom driven and then your hormones fluctuate throughout the day. So it also depends on what part of your cycle you're in and all of that. So when I get asked that question, you can start whenever you feel it. But when you have the symptoms, that's when you want to start, getting prepared for perimenopause, menopause, through hormone replacement therapy. Okay? That said, how soon can you start hormone replacement therapy? What do y'all think? What's the soonest you could start it? Yes. When you start having problems and when you're done having kids. We can treat you in between. You would have to be very, very honest with your provider.
I think I'm done.
I'm planning to get pregnant in this amount of time so we can make sure that you're
I'm like, I didn't know that.
Most people in perimenopause and menopause cuss at me when I say, do you want to name more children? And they're like, oh no, I'm done. And so,
Oh God.
once you're kind of in that space, it's a good time to start.
Oh God, it's
Because
scary.
what the studies are showing now, estrogen is cardioprotective, meaning it protects your heart. And so it's decreasing your risk of heart attacks. It's decreasing your risk of strokes. It's also decreasing the risk of brittle bones that we talked about, the osteoporosis. So if you know that inevitably we're all headed towards this direction or we're going through it now, why not start when you can, right? And so another question I get asked is how long do you have to be on hormone therapy? Totally a personal decision. It's totally a personal decision. Because you can stop, and if you're like, okay, my life is great, I have the energy to do the things I want to do, I'm sleeping well, then you are well to get off. But a lot of women get off and they're just like, no, I can't function without it. And so it's not something you have to do into perpetuity, but it is something that helps you as you're going through certain phases of life. Okay? Testosterone has also been found to help with cholesterol because the properties that make testosterone use cholesterol to do it. So in some regards, it's helping lower your cholesterol. Now, what I did not say is you can eat a whole bunch of junk and have high cholesterol.
Because you go, yeah.
However, when you're eating healthily, exercising, because both of those things, like Dusty mentioned, are going to help with the symptoms that you have, that cholesterol is used for better purposes. Okay? Another thing that estrogen was found to be protective against, not completely, but it supports, is not getting Alzheimer's. Okay? So notice when your estrogen level decreases, that brain fog that almost everybody raised their hand to say they knew they were having brain fog, that's going to increase. Okay? So it's a direct correlation, and so studies are now saying estrogen plus other hormones are protective against that. So again, nothing is absolute. So I'm not saying you use estrogen, you'll never have Alzheimer's, but it does help decrease the chances of getting it. Make sense?
Question over here. You got two questions.
Yes, yes, yes.
Yeah, I don't even know what area I'm at. I'm kind of in a water pause.
I'm gonna steal that. Okay.
But
So
truly, I don't know because I'm already much older than I guess a lot of women here. I'll be 64 the end of this
and you don't look it. Very nice.
Right.
But after this, I'm going to look better. But anyways, so in terms of hormone therapy, is this something that, I know you talked about some of the physicians, they won't know, but are there some that would? Because I did go through a point where I was feeling kind of depressed. The first thing they do, they medicate you. And I hate that. I don't like, medicine like that. So I'm just wondering, are there other physicians, medical that would validate hormone therapy? Or should I just go to you?
Yes.
But
yes.
To answer your question, yes, your primary care providers will treat you to a certain point. For women, it's going to have to be an extreme case for them to give you testosterone. That is almost a hard no every single time. Okay. For estrogen, they will give you suppositories, so the vaginal insertion applications. Some will give you patches. And for a lot of people, they tolerate the patches very, very well. And so if your insurance covers it, and that's the more economical way to do it, I yourself. Progesterone, a lot of times they'll give that orally, whereas if you speak with hormone specialists, we have orals, we have topicals, and we also have pellets, which we'll talk about in a second. So to answer your question, if you have a good provider, they'll give you the estrogen and progesterone. A lot of them are hesitant because they just don't want to follow it. They don't have enough knowledge about it. Or they're just like, that's not something typically in our matriculation that is taught, right? So it's like, okay, I'm giving you this estrogen. You're still having problems? Well, go exercise and take a nap. So that's a lot of times what you run into. So have the conversation. If you guys leave with nothing else today, have the conversation with your providers. See what they're willing to do and what they're not willing to do, and then the decision is yours from there. But,
Right.
right. After all the house
Yeah, that's right.
Question over here, and then over there.
Okay.
So, Stella?
So, yeah,
This is my
from
friend.
a cancer standpoint,
Yes.
so which ones are you using that I don't have to worry about my patients having risk for breast cancer?
So, great question, because breast cancer is everyone's fear. Number one, bioidentical estrogen is going to significantly decrease the risk than the ones we were just talking about. Your family medicine provider, 9 times out of 10, is not going to give you bioidentical. So remember, bioidentical is what your body makes, and when you use it, your body recognizes that this is Larissa's estrogen. Otherwise, it's synthetic. It's made in a lab, and it mirrors the estrogen, progesterone, or testosterone that you would take. And so there's different chemicals in there. That is the estrogen with progesterone, so it's balanced. It's the estrogen when it's in excess that usually leads to the cancer standpoint of it. So when you are on oral birth control over 35, pretty much any provider tells you, especially if you're a smoker, to stay away from estrogen because it increases the risk of blood clots, right? So that's what Dr. Spoke asked about. Bioidentical within range does not cause blood clots. The other thing is you want to go to a provider that's testing your labs on a very regular basis, 3 to 6 months. For me to go 6 months I have to know you. We've been at this dance for a long time. I know you're comfortable. Otherwise, every 3 months we're checking your labs just to make sure things are comfortable for you, because hormones fluctuate on a day-to-day, right? Today you watch that Dawn commercial with the duck stuck in the soap and you're crying, and the next day you're full of energy and full of life, right? Just like your hormones fluctuate, your therapies can fluctuate too. So we monitor labs on a very, very frequent basis. Another thing is if you're prone to having blood clots on a very frequent basis, we typically don't start hormone therapy in you, okay? So that's something that you want to be honest and forthright about. Your medications you're taking and your medical history. Because we're here to help you, not hurt you.
Thank you. We had a question back here.
Well, it wasn't a question, it was a comment from her. I had the same issue when I went to my primary care. She was like, you're not in menopause, your lab is showing this, so I was like almost arguing with her. So I demanded to see an OBGYN.
Yeah, I was gonna say.
So they can do an exam. And as soon as the OBGYN looked at my labs and I told her my symptoms, she said, no, you're in menopause. Because I'm having the night sweats, I'm waking up wet, I'm hot all the time. Normally a cold person, I'm like, extreme. I'm taking my air conditioner, like I take my AC like I'm super hot. So I had to like demand my primary care, like I want to go see an OBGYN because something's going on with me.
And what I love about what you said is you advocated for yourself.
Yeah.
A lot of times we'll hear, go home, take a nap, and then you're just like frustrated, you give up, right? No, advocate for yourself. The other thing with the labs, hormone specialists interpret the labs just a smidge differently. In family medicine, it's like, okay, this lab is normal, you're fine, I'll see you next year for your physical. Just because your labs are normal does not mean that they're optimized.
Yes.
When your labs are optimized, you feel great, right? So a testosterone, as an example, at a level of 5 could be considered normal. But at a level of 5, most people can't get out of bed. They're so exhausted, right? So that's when you have to seek outside sources so that you can supplement your testosterone. And again, we monitor to make sure you're staying in a safe space so that your libido gets higher. And one of the things that Josina said that I really love, libido starts where? In your brain. In your mind, if you're like, this man is repulsive, you want to do what? Like, I'd rather run a marathon. I can baby and what I tell patients with the decrease in libido, be selfish. This is just for them. It's for you too. That's for y'all to enjoy as well. Start the mental gymnastics in the morning so that you're mentally there, and then the testosterone helps with that as well. Yes. So.
No one's mentioned this, but, oh, go ahead. Me? Okay. Do you get, with the hormone changes, I tend to get, I'm more cold. Not cold as in temperature cold. Cold. I have no emotions like I used to. I used to be a little bit more emotional. Now, I don't cry. My daughter can come to me and tell me something that's very emotional, and I'm because I don't know, the feeling is not there. I kind of feel like a man.
Did you have it before? Did you have it before? Previously, if your daughter came to you crying, were you more?
Oh, I would see a little bit more, but I feel like now it's just come to the point where sometimes I just say, man, I feel like, man.
Yeah. Numb was a good word. So I guarantee you are metabolic. Your estrogen probably is in its balance. So when your estrogen is low, it's just kind of meh. That's how you feel about a lot of things. When it's high, it's like, you stubbed your toe, oh my gosh! Like, anything, right? So you get yourself stuck, it's fine. And so I bet you if we tweaked your estrogen and progesterone just a smidge, you'd be like, Larissa, I feel it. Like,
So, sorry, I'm gonna piggyback off what you said about the hot flashes, cause that, I'm sorry, about the blood clots, cause that's my issue. My GYN refused to give me anything.